Trichomoniasis, or trich, is one of the most common sexually transmitted infections in the United States. That is right, it is so common, and it's caused by a parasite. That's right, I'm going to tell you how it's transmitted, but not only that, what the treatment is, what the symptoms are, the symptoms for men and women, and so much more. Guys, I'm Dr. Jen. It is good to see you. Now, I know you're asking yourself, or me rather, okay, how do I get this? How would I get this? Through sexual activity is primarily the means of transportation for this parasite. Okay, we're talking vaginal, oral, or anal sex. Okay, and trich can be spread even if the person who has it doesn't have any symptoms. So don't allow you to say to yourself, oh, I don't feel anything, I don't see anything, and I must be fine. No, you don't have to have symptoms, but we're going to get into the symptoms in a moment. Also, genital touching potentially could spread it. So a man doesn't actually need to ejaculate for trich to be spread. And trich can be passed between women who have sex with women. So please know that, okay? Now back to the symptoms. What did I say? I said about 70% of people with the infection don't have symptoms. 70% don't have symptoms. But when someone does have symptoms of trich, it can range from mild irritation to severe inflammation. And when do symptoms start? You may be wondering, well, I would say about within 5 to 28 days after getting the infection. It's kind of a long range, but that is the case. And then sometimes people don't get symptoms until much later, and symptoms can even come and go. So you see how there's like a lot of variation with this, right? Let's go to the symptoms. And let's start with the sorry, that was weird. Let's start with men, okay? What symptoms do men get? They might get itching or irritation inside the penis. You might feel burning after peeing or ejaculating, feeling uncomfortable down there. Or you might even have discharge from the penis as well. By the way, men, discharge from the penis should always make you go in and get seen, right? Okay, along with other symptoms, but especially discharge. Women, on the other hand, get itching, burning, redness or soreness of the genitals, etc. Discomfort when peeing. It could burn or feel not so good. And then there may be a discharge, clear, white, yellow, or green vaginal discharge. And it may have a fishy smell, okay? And also keep in mind that if you have trich, sex may very well be uncomfortable, okay? And you want to get treated. Really, this is important because if you don't get treated, there actually can be some pretty negative consequences. All right. So prevention, how do we keep this from happening, right? So the only way to avoid sexually transmitted infections really is to not have vaginal, anal, or oral sex, or to be involved sexually with someone who has these things. What are ways to minimize your risk of getting trichomoniasis or trich? Limit your sex partners, okay? Don't have multiple sex partners. Be in a long-term, mutually monogamous relationship. Mutually monogamous means that you're both monogamous, not just one person, okay? One person can't be in a relationship and the other person be single, if you know what I'm trying to say. The other thing is you both got to get tested, all right? And you both need to know that you don't have trich. That's a way to really decrease the risk of having it. Also, using condoms, right? Condoms are like, oh, thank goodness for condoms because they help prevent STDs, STIs. Also, make sure you're having a conversation with your partner. I know it's uncomfortable, okay? But you got to do this. And you need to get tested before you have sexual intercourse or activity with a partner. And as far as I'm concerned, you need to show each other your results. That's right. Pull them up on the phone. Now there's patient portals and stuff like that. Pull up your results and show your partner. Don't take somebody's word for it. I'm not saying they're lying, but you deserve to see it for yourself, okay? All right, so treatment. The good thing is this unfortunately common ST is sexually transmitted infection it's treatable, okay? And it's a medication that you take by pills, all right? It's also safe for pregnant women. Just know we can treat it. So this is good. Now, if you get treatment for trich, understand you can get it again, so you still need to be careful. And to avoid reinfection, your sex partners, by the way, should receive treatment at the same time. So if you get trich, your partner needs to be treated for trich. Another reason why you got to talk to your partner about everything, but especially if you get a sexually transmitted infection, you got to talk to your partners and tell them. Even if it's not trich and it's something else, talk to your partners. It helps you and it also helps keep them safe, okay? And just keep in mind, this is according to the CDC, you shouldn't have sex again until you and your partner complete treatment. And you should get tested again about 3 months after your treatment as well, just to make sure that both you and your partner are doing okay. As I'm Dr. Jen Caudle, practicing family physician, on-air health expert and video creator. Please subscribe to my channel. Follow me on Facebook. I'm on TikTok, Instagram, LinkedIn, WhatsApp. And subscribe to my free health newsletter at drjencaudle.com. Love y'all. Bye.